and you're like, hey, what to do? Well, the doctor is not open, and US does not function like India in many ways, which is, you make a phone calls and, yaar, kuch nahi yaar, theek hai, ye laga lo, wo laga lo, everything is fine. Doesn't work that way. You get all paranoid about things, and you go to ER, emergency, because emergency is 24/7. And the way the healthcare is structured in the US is what all you care is $50, $60 for, because you're paying you have an insurance card, and the insurance company is taking a premium for you for a certain month or a year, and then you rush to the ER. Then this guy says, oh my God, there's a problem, blah, blah, blah. There are like 10, 15 tests. And guess what? It's a rash because of an allergy. Well, what you care as a member is, hey, listen, man, there was a rash. I went to the doctor. This guy gave me an injection. I'm fine. But think about it. If I am a hospital, the money that I have to spend on a simple rash? You kidding me? Of course, we all hit panic buttons, but it's all about, that was a challenge on hand. That's the challenge, because we spend so much of money. The insight, I'll pause there and have you read that. A little bit of healthcare in it, but I think the bottom line is that, when this guy checks in, there's data, comes in, and then there's whole diagnosis codes, and here's how we solved it. I'm trying to simplify this. It's not as easy as it looks, but this is what it is. We talk about seasonal things. I'm giving you an example. The seasonal things, there is fall that's going to kick in. The pollen is going to be out there. The allergies are going to kick in. What is your strategy to make sure that this patient does not run to the hospital? And if you don't know the healthcare business, let me tell you that the money that is made is by managing cost. So let's say I am a member of a health plan. If I keep going to the doctor again and again, guess what? The payer and of course the provider would be happy to see me again, but the payer is really taking that plunge of getting that expenses. The only way that a payer can make money is to make sure that I don't keep going to the doctor again and again. And how do you do that? That's where analytics come into play. To be able to predict, to be able to plan and execute the strategies that can help the member to plan better, take the pills on the right time so that this person does not run to the hospital. That's the outcome that we serve for. Now, times are changing, changing pretty fast. And, I think it's changing in India in many ways too. But there was a time that the doctor or the primary care physician or the provider had all the attention because, I'm the guy who's giving you the service, so I am very important for you. And then the payers came in saying that, hey guys, I will take the risk and I'll mitigate the risk for you, I'll manage the risk for you, and that's how the payers came into the picture. And guess what? The spotlight is on the member. The spotlight is on the member now. When I say the member, it's you and me who are going to buy healthcare, who are going to go to the doctor. Very recently, as recent as yesterday, that I was talking to somebody that no more is the case that you go to the doctor and the doctor tells you XYZ and you will say, oh great, thank you doc, XYZ, I'm going to take the XYZ medicines. The times have changed. You ask the doctor, what does this medicine do? What does that medicine do? Then you go to the pharmacist. Then you ask, is there an alternative for that medicine? Because people are getting more educated about this, that it's the formula. If there's a generic version available for a certain drug, so be it. It's all about the car with 4 wheels. It doesn't have to be a BMW all the time. That's what is changing the world of healthcare. That's why we're saying that the times are changing and member is in the spotlight. And guess the future. Guess what is the future of US healthcare? Wild guess. We all talk about shopping, right? I don't know if you're abreast with things that are happening in US. That's what is happening in US. People are shopping healthcare. If I'm working for an employer, originally that thought was that they will shave some of my salary towards a health plan and take that plunge. But now companies are saying, hey, I'm going to give you $1,000 per month, go out there, shop. I'm not going to tie up with larger companies and things like that. Go out there and shop for your own healthcare insurance. And to make it even more complicated, you won't believe this, that there's a talk about pay as you go. It's almost like mobile services. It's like the prepaid card. You know, so it's getting so aggressive in the marketplace that it's just pay as you go. I mean, well, so be it. I'll come back to this example that I had in mind called FMHP, Federal Mental Health Parity, where analytics played a very pivotal role in transforming what healthcare is today from 2010 in the US. It's a funny thing, but it's reality. And we are all doing business, so we all know how things work. So in the US, when it was healthcare coverage, it was physical healthcare coverage. So if something happens to me on my hand, feet, whatever, that's covered. But mental disorder, mental illness was never covered. So there was a federal mandate saying that every payer will have to now cover for mental disorders and mental issues, mental health. So hence the federal mental health parity. Just imagine you as a business. Till date, you have 100 people that you're covering for physical conditions. Given the fact that now you have to cover for medical conditions, you will say, hey, the premium is double. Do you think people are going to come to you? No. So just imagine what analytics could have done to be able to price it to a point that there is no huge impact on the consumer, but yet survive the business. So that's the example that I had in mind. I have maybe a minute left, and I'm done with my presentation, but I said I will touch upon some of the perspectives that I had based on the conversations. The first thing that came to my mind is garbage in, garbage out. You feed garbage into a system, you will get garbage out of the system. So when we talk about this whole analytics maturity curve, and we talk about this whole data quality, data enhancement, data integration, data transformation, that's the chain that you follow, right? But the bottom line is data quality, which is the starting point. You don't have data quality, boom, gone. What are you talking about transformation? You don't have the data quality in place. So think about those elements that are very, very important, extremely important. The second thing that I wanted to mention was that think about, I've heard many times that, thank you. I've heard many times that there's this pyramid, there's this consulting pyramid. And I thought about this consulting pyramid and I said I need to draw a parallel analytics pyramid because consulting is also a widely abused term, and so is analytics. So I thought it's not a bad idea to draw pyramids, right? So the pyramid, just imagine the top of the pyramid is consulting, which is absolute strategic work. It's absolute strategic work. This guy is a CXO talking to you from a consulting standpoint, and he's just talking to you of a simple thing. How do I plan for my future? I don't know what I don't know, but you are the guys who are experts. You come in, tell me how the world is moving and how do I plan for the future. That's the top of the pyramid. The middle layer is the customer or the client or CXO, CFO is calling you from a consulting standpoint and telling you, I know the problem, please solve the problem. And that's called solutioning. Please do not confuse that with consulting. Right? I know the problem, please come, SAP, Oracle, whatever, Hadoop, whatever, come solve the problem. That's solutioning. And the bottom of the pyramid, people love to call it consulting, but guess what? It's staff augmentation. I will tell you what to do. You don't think what to do. I will tell you what to do, and you do it on time. That's staff augmentation. Now, let's look at the parallel for analytics. The bottom of the pyramid, oh, we do analytics. Flashing news, you do reporting. I tell you what to do. You publish those reports, you do reporting. You don't do analytics. The middle of the pyramid. Oh, we do analytics. No, you use Tableau. You do BI stuff. It's called business intelligence. It's not analytics. Oh, so that's it. The top of the pyramid is analytics. I'll leave you with that thought and I'll be open to questions. Yes, oh my God. All right, Deba, go for it.
Yeah, you have said so much about consulting, I can't help but ask a question. Thank you for a great talk. Just trying to understand about the Optum, platform. You mentioned this is about the US healthcare plan. So two-fold question. This is only applicable for the US market, or you are thinking about other global markets as well, Europe, Asia, and other places? And the second one is with all the digitization that's happening right now, is the platform able to integrate that with, let's say, the Fitbits or other sort of those real-time information that is feeding in from the patients? So those were the two-fold questions. Thank you.
Thank you for that question, Deba. I think it's an interesting question. The first part is, yes, we're doing some work in the UK market. In India, I think we're beginning to make inroads. As I said, it's garbage in, garbage out, right? The bottom line is, sorry for my usage of Hindi, but अरे पता नहीं कितने आधार कार्ड है उसके पास. Let's get that, right? So it's going to be very tough because data quality is predominant in healthcare. So it's very critical for us to understand the market, and we do a lot of government, we have engaged with some governments, state governments, but we're slowly picking up. And in India, we have the whole horsepower that supplies to US is based out of India. That's the first piece. That's the answer to the first question there. But the second piece is real time. I may be a little uncomfortable to share the data with you in terms of how and where we hook up. But I can give you a context that, I was talking to somebody yesterday and saying that, wouldn't it be wonderful if all the health plans come together so we have data of all the members, and just imagine we shake hands with a Walmart or a Tesco or a Target or a Costco. So we have the retail behavior, then we have the health behavior, and guess what? We'll go to the banks, right? And get the financial details. So now we have the clinical data, we have the financial data, and then we have the retail data. We can make the member's life miserable. Even before this guy swipes and buys a Coke, he will not be allowed to buy a Coke. So, well, it's a perfect marriage there, but I guess we have a long way to go to get to that point. But yes, there are things that we're doing at real time. Yeah, we can share when you join us. Just kidding. No, we love that. Anything more? We're all set. Again, as I said, there's a booth out there for United Health Group. Feel free to reach out to the booth, talk to our folks. We'll be more than happy to, I would say, educate you, if you will, and help you in any information that you want to find. Thank you, folks.
Thank you so much, Subbu.